Which pain type are you experiencing? Hello, I'm Baram Jam, and welcome to the Pain Truth program. Note, all the images in this presentation are AI generated. Based on the International Association for the Study of Pain, there are two basic types of pains, primary and secondary. On which type of pain are you experiencing? Let's play a game. Name that pain. After banging your thumb with a hammer, which type of pain would you say it is, primary or secondary? The answer is, it's secondary pain. Secondary because the pain is secondary to a banged thumb with a hammer. If the thumb was never injured, the skin, the nail, the bone, there would be no pain. So secondary pain is related to an injury or a trauma or a disease that occurs in the body. So let's continue with name that pain. A cut or a scraped skin, primary or secondary? Secondary. The pain is secondary to a scraped skin, because if there was no injury to the skin, there would be no pain. A strained muscle, like an athlete who strains their muscles, primary or secondary? It's secondary. If the muscle did not get injured, there would be no pain. And as the injury heals, the secondary pain resolves. A broken hip. My grandmother fell down and broke her hip. Which type of pain did she experience? Secondary pain. And as the hip healed, the secondary pain resolved. How about knee osteoarthritis, primary or secondary? It's secondary to joint changes, and it's often relieved by medications and some exercises. It can certainly help with knee osteoarthritis, but it's secondary to joint sensitivity. Sciatica, when the MRI is showing a nerve compression, primary or secondary? It's secondary to a nerve irritation or a compressed nerve root. It's quite painful, but there's a logical explanation for the pain, a pinched nerve. Kidney stones, primary or secondary? It's secondary to kidney stones. If there were no kidney stones, there would be no pain. Rheumatoid arthritis, primary or secondary? It's secondary to an autoimmune disorder causing inflammation and pain in the joints and the body. An infection or pneumonia, be it strep throat or lung infection, primary or secondary? It's secondary pain because it's caused secondary to an infection. When the infection gets better, the pain also resolves. Cancer, pain from a tumor, primary or secondary? The pain is secondary to a tumor. When people receive chemotherapy, radiation, or surgical removal of the tumor, fortunately, the pain also improves. Fact number 1, modern medicine is incredible at identifying secondary pain. Thanks to research and our growing knowledge of the human body, thanks to x-rays, CT scans, MRIs, and blood tests, and other lab tests such as urine tests, fecal tests, skin and tissue tests, and there's a lot of medical tests that people can undergo to detect various diseases and pathologies in the body. Fact number 2, modern medicine is incredible at treating and often curing secondary pain, thanks to physical interventions such as knowing when to rest and when to move and exercise, physiotherapy treatments, medications and injections, and if need be, surgery. Injuries to muscles, tendons, and ligaments can quite easily be identified with a good physical examination and, if required, with various imaging tests. These injuries are very often effectively treated with time, temporary activity modification, bracing, and physiotherapy. After all, injured athletes often get back to their full sports in just a matter of weeks. Broken bones and joint injuries are also quite easily identified with a good physical examination and a simple x-ray. Broken bones and joint pains are often effectively treated with temporary activity modification and physiotherapy. Sometimes there's a need for bracing, medications, or injections. Sometimes there's a need for surgery or a total replacement, and then people get better. Infections or kidney stones can be identified with a good physical examination, imaging, and blood tests. Modern medicine is incredible at identifying and treating many of these types of illnesses. Disc herniation with a compressed nerve root can be identified with a good physical examination, a nerve conduction test, and an MRI. Nerve irritations can often be effectively resolved 100% with temporary activity modification, physiotherapy, medications, and if need be, injections. Sometimes there's a need for surgery, and then people get better. Rheumatological diseases can be identified with a good physical examination and blood test. Although modern medicine doesn't yet have a cure for various autoimmune disorders, symptoms can be somewhat managed with various pharmaceutical interventions. And thanks to the incredible advances in cancer research, modern medicine can now detect many cancers earlier than ever before. Thanks to modern medicine, many cancers can now be treated successfully, and survival rates for many types of cancer have improved dramatically. In summary, secondary pain is often easily diagnosed and symptoms usually fully resolve with time, temporary activity modification, various therapies, medications, and if need be, surgery. Modern medicine is great for diagnosing and treating secondary pains. However, when it comes to primary pain, the current healthcare system is failing patients. So, what is primary pain? It is a pain experience that cannot be explained by another diagnosis. It is often accompanied by emotional distress, anxiety, frustration, grief, or anger. The pain might show up in one area and then it might spread and go to another area. No scan or blood test can fully explain it. And primary pain does not respond to treatments that are typically effective for secondary pains. So let's continue with Name That Pain, because by now you may be wondering, what is exactly primary pain? I need some examples. Well, let's continue with the game. Phantom limb pain, primary or secondary? The answer is primary. Did you know that 70% of people after an amputation experience pain in a leg or an arm that is no longer there? That's not a rare thing. It's a common experience by people who have an amputation. Phantom limb pain cannot possibly be explained by something being wrong where the pain is, as the body part that hurts or burns or itches is not even there. Therefore, phantom limb pain cannot be resolved by focusing on the body part because it's not there. Yet the pain is 100% real. Irritable bowel syndrome, or IBS, primary or secondary? Primary. When stomach pain and sensitivity persist and doctors are unable to find the cause, it is diagnosed as IBS, and the pain is real. When it comes to IBS, no physical treatments, medications, or dietary changes have been found to consistently solve the unexplained stomach pains. Fibromyalgia, or chronic fatigue syndrome, primary or secondary? Primary. Unexplained pain and fatigue in the entire body, lasting longer than 3 months, is diagnosed as fibromyalgia. This pain is not secondary, it is primary. When it comes to fibromyalgia, the pain and fatigue cannot be resolved by just fixing a body part. In fact, the harder one tries to fix the body through various therapies or medications, the worse one may feel. Let's continue with Name That Pain. Headaches, primary or secondary? It's a tricky one. The answer is both. Headaches can be either primary or secondary. However, most are primary. Secondary headaches are much less common and occur because of an underlying condition such as sinus infection, meningitis, a stroke, or there's an actual structural changes to the brain. head injuries, or brain tumors. When most people experience a headache, there's no identifiable tissue injury, infection, or tumor, or structural abnormality causing it. Most headaches are classified as primary headaches, meaning the pain is real, but the headache itself is the condition rather than a symptom of detectable tissue damage. What is happening is that emotional stress, anticipation, anxiety, poor sleep, frustration, and other factors influence the brain's protective systems, which can produce a genuine headache without any detectable tissue injury. Have you ever had a headache before an exam, before public speaking, during an argument, or after a terrible night's sleep? Almost everyone has. The pain is unquestionably real, but there is often no damaged tissue to find in the head or the brain. If someone develops a headache because they're stressed about their mother-in-law visiting, no blood test, MRI, or X-ray will reveal any structural changes in the head or the brain. Yet the headache related to the stress is completely real. Low back and neck pain, primary or secondary? The answer is either one. Low back and neck pain can either be primary or secondary. However, many doctors, therapists, and patients falsely assume that low back and neck pain are always secondary. Secondary to bad posture, secondary to the alignment or the shape of the spine, secondary to muscle tightness or weakness, secondary to normal changes that are seen on X-rays and MRIs, such as degeneration or arthritis or disc bulges. When neck and back pain have failed to improve despite rest, medications, therapies, with all kinds of exercises, injections, or even surgery, there's a great likelihood that the pain is primary. Therefore, it will not resolve with attempts to just fix the body. Persistent shoulder, elbow, hand, hip, knee, foot, or jaw pain, or TMJ pain, primary or secondary? Again, it's a tricky one because the answer is either. Any pain located anywhere in the body can either be primary or secondary. However, many doctors, therapists, and patients falsely assume that these pains are always secondary. When various pains in the body have failed to improve despite rest, medications, therapies, with all kinds of exercises, injections, or even surgery, there's a great likelihood that the pain is primary. Therefore, it will not resolve with attempts to just fix the body part. Knowing what you now know, which type of pain do you think you're experiencing? Secondary pain or primary pain? Let's review some of the characteristics. Secondary pain is linked to a detectable injury or disease. Examples: bruises, torn muscles, broken bones, osteoarthritis, compressed nerves. Primary pain starts and persists without a sufficient detectable injury or disease. Examples: fibromyalgia, many headaches, irritable bowel syndrome, widespread pains, and some localized persistent pains. Secondary pain is real, and primary pain is equally real. When it comes to secondary pain, medical tests often reveal a cause. However, in primary pain, medical tests are often normal or show irrelevant findings that only increase fear and worry. Secondary pain is responsive to various medical and therapeutic treatments that focus on treating the body. However, when it comes to primary pain, it's not responsive to various medical and therapeutic treatments that focus on treating just the body. Secondary pain is localized to a body part or follows a nerve pattern. However, primary pain can be localized or not have a pattern at all or move around to other areas of the body for no reason. And finally, secondary pain, when you're treating the body, often gives permanent relief. However, when it comes to primary pain, treating the body at best gives temporary relief, but the pain always returns. So knowing what you now know, which type of pain do you think you're experiencing? When it comes to primary pain, modern Western medicine does not offer any long-term solutions other than symptom management. Though the pain is 100% real and is felt in the physical body, the healing often begins not by fixing a body part. It resolves by understanding pain, shifting your relationship with pain itself, and perhaps some simple lifestyle changes. Welcome to the Persistent Pain Clinic. As you can see, many people line up for medications, injections, or even surgery, and people line up for manual therapies, needling, and acupuncture, or tingling machines. However, there is no lineup for understanding pain, mindset shift, and lifestyle changes. People don't believe in this approach, including physicians and specialists, and the general public. However, that is where the solution lies. To learn more, please view the intro videos on thepaintruth.org. Thank you.